I always loved living in the city. I'm a real kind of city boy. Hobart's just much quieter. It's a much more stable pattern of life that I like. I find that I can spend a lot more time focusing on myself. I am the current consultant psychiatrist at a facility called Millbrook Rise Centre. We're a psychosocial rehab centre. We're about 27 beds big. Definitely one huge thing that I found when I came to Hobart is the quality of the training program here. It's very tailored because you only really have maximum 3 or 4 trainees going through to any one of the examinations at one time. I think you can really get a lot of input from very senior people, including people who are or have been examiners. Very quickly, essentially I went from being a stage 3 trainee with very part-time psychiatrist to being the psychiatrist of the unit. I really felt I was able to spread my wings as a stage 3, kind of becoming a consultant psychiatrist during that period. For me to be able to be a consultant here means that I can run the team and the ward the way I want to. I can innovate the way I want to. I can treat people with what I think is a good approach, and I can really try to ground that in these principles that I think are really important, like compassion, empathy, really seeing the person as a wider being rather than simply somebody with an illness, and to involve the family the way I would like families to be involved. The kind of approach that I want to get from my ward is that it's a good place to work. I want a workplace that is very supportive to each other, so that staff support staff and staff support patients, and hopefully that translates into a wider culture and a wider kind of milieu on the ward where people can start focusing on getting well. I supervise 2 registrars. Supervising trainees is very rewarding, especially when you start seeing them really improving their core clinical skills and become more sophisticated clinicians themselves, and I think that's really gratifying. The nice thing about Hobart is that it's very sparkly. So even in wintertime, on a clear day, it's the whole harbour and the Derwent River are really pretty. They're very blue, they glitter in the sunlight. I enjoy looking at the galleries here. They're obviously not gigantic galleries, but I like how personal it feels. I find that, in general terms, regional art galleries are very much more intimate than large galleries. One of the benefits of living in a small community is getting to know the people around you. I really like the community kind of feeling that you get. It is nice actually to go out and to see patients out doing things, that they've transcended being a patient and they start to become just a person again, and you help that. I was walking past a cafe one day and this guy came running out and said, doctor, so nice to see you again. And I treated him, and he was in a really bad place at the time, but he was working as a chef. So it's nice. It was nice to see him really functional again and enjoying his life and working. Sometimes you'll see from afar, you'll see people shopping with their families or their loved ones. It's a really nice thing to be able to see in your community, and you really feel like it's in a way that you've contributed to that. If you're considering rural or regional training, you should just go and do it. You gain a lot of clinical experience, and people are very grateful to have you there. It's a nice combination of things to be able to do in your early career.